Imagine checking your bank account one morning. Your Social Security payment arrived right on time. Nothing looked unusual until you noticed the deposit was smaller than you expected. Your first thought might be, did Social Security reduce my benefit? Maybe there was a mistake. Maybe your payment changed. Or maybe something happened that nobody told you about. For thousands of seniors every year, that moment creates confusion. Some people immediately call Social Security. Others blame Medicare, and many simply accept the smaller deposit without ever finding out why. Here's the surprising part. In many cases, your retirement benefit didn't actually go down. Instead, one Medicare deduction quietly changed the amount that reached your bank account, and most retirees never notice it until months later. The problem isn't always the deduction itself. The problem is not understanding why it's there. Today, I'm going to show you one Medicare deduction that many seniors overlook, why it appears, when it can change, and the simple steps you should take before assuming something is wrong. Because understanding this one number could save you hours of frustration and help you avoid making decisions based on the wrong assumption. Let's start with something every Medicare beneficiary receives, their monthly Social Security payment. Every month, millions of Americans receive a Social Security payment. Most people do exactly the same thing. They check one number, the amount that was deposited, then they move on with their day. But very few people stop to ask, was this the amount I was actually supposed to receive? That question matters, because the number that reaches your bank account isn't always the same as your full retirement benefit. For many Medicare beneficiaries, money is deducted before the payment is deposited. And one of the most common deductions is the Medicare Part B premium. Now, that doesn't mean something is wrong. For most retirees, this deduction is completely normal. In fact, many people have had it deducted automatically for years. The problem is that many seniors forget it's there. Until one month, the deposit suddenly looks different, and that's when the phone calls begin. Now, here's where many retirees get confused. They believe their Social Security check and their Medicare costs are completely separate, but in many cases, they're connected. If your Medicare Part B premium is deducted automatically, you won't receive your full retirement benefit in your bank account. You'll receive what's left after the deduction. For most people, that's exactly how the system is supposed to work. But here's what catches many seniors off guard. One year, your deposit looks normal. The next, it seems smaller. Nothing else changed. Your retirement benefit didn't suddenly disappear, yet the amount in your bank account is different. That's the moment many retirees begin asking questions. Did Social Security reduce my payment? Did Medicare raise my premium? Did I miss a letter? Sometimes the answer is simple. Your Medicare premium changed. Sometimes the deduction increased because of income reported from a previous tax year, and sometimes there is another explanation entirely. That's why guessing is the worst thing you can do. Instead, open your latest Social Security statement. Look for three numbers. First, your total monthly retirement benefit. Second, your Medicare Part B deduction. Third, the final amount deposited into your bank account. Once you compare those three numbers, everything becomes much easier to understand. Most seniors only look at the final deposit. Very few look at how that number was calculated. And that's exactly why this deduction causes so much confusion. Here's another mistake many retirees make. They assume every higher deduction means something went wrong. That's not true. A higher deduction does not automatically mean there's a mistake. Sometimes it's completely correct. The important thing is understanding why it changed, because once you know the reason, you stop worrying about the wrong problem. And you start asking the right questions. If the deduction makes sense, great. You now understand exactly where your money is going. If it doesn't, don't panic. Write down the amount, gather your latest statement. Then contact Medicare or Social Security and ask them to explain the deduction. A 5-minute conversation can often clear up months of confusion. But here's something even more surprising. The Medicare deduction isn't the biggest financial mistake many retirees make. The biggest mistake happens before they even look at their statement. They assume everything is correct, without ever reviewing it. And that's exactly what we'll talk about next. Because one simple yearly review could prevent many of these surprises before they happen. What should you do if your Medicare deduction looks different than expected? The answer isn't to panic, and it isn't to assume something is wrong. The smartest thing you can do is review your information before making any conclusions. Start with your latest Social Security statement, find your monthly retirement benefit, then find your Medicare Part B deduction. Finally, compare both numbers with the amount that actually reached your bank account. If everything matches, that's great. You now understand exactly how your payment was calculated. But if something doesn't make sense, don't ignore it. And don't rely on social media comments or rumors. Call Medicare or Social Security directly. Ask one simple question. Can you explain why my Medicare Part B deduction is this amount? Most of the time, you'll receive a clear explanation, and if there's something that needs to be reviewed, they can also tell you what information or documents may be required. Here's something many retirees don't realize. A simple yearly review of your Medicare information can prevent months of unnecessary confusion. Healthcare costs change, premiums can change, your income may change, and your personal situation can change too. That's why reviewing your benefits once a year is one of the smartest financial habits you can build. Think of it the same way you review your bank account or your credit card statement. You aren't expecting something to be wrong. You're simply making sure everything is accurate. That one habit can give you confidence that your retirement income is working exactly the way it should. Now let's quickly review today's takeaway. First, don't focus only on the amount that reaches your bank account. Understand how that amount was calculated. Second, know that Medicare Part B premiums are commonly deducted from Social Security payments. A smaller deposit does not automatically mean your retirement benefit was reduced. And third, if your deduction changes or doesn't make sense, review your statement first. Then contact Medicare or Social Security before assuming the worst. A few minutes of reviewing today can save hours of confusion tomorrow. If you found this video helpful, subscribe for simple, reliable Medicare and Social Security updates designed specifically for seniors. Every week, we explain complicated benefit rules in plain English without confusing language or unnecessary rumors. Now I'd like to hear from you. Have you ever noticed your Social Security check was smaller than expected? Or have you ever checked your Medicare deduction before today? Leave your answer in the comments below. Your experience may help another senior who has the same question. And if you know someone who receives Social Security or Medicare, share this video with them. They may discover something they've never noticed before. Thank you for watching, and I'll see you in the next video.